Welcome back. In your morning medical news, drowning is the #1 cause of death for children ages 1 to 4. CPR can be life-saving, but the guidelines for performing it on drowning victims have recently changed, as Michael George explains.
What happened to 3-year-old Judah Brown could happen to any family. His mom, Christy, says Judah slipped away at a friend's barbecue and got into the pool. When they found him several minutes later, he wasn't breathing. Bystanders tried to resuscitate him with chest compressions, but not rescue breaths.
And I do believe that if he had gotten those breaths, if we had known to do those breaths, then he possibly could have survived his drowning.
Until recently, guidelines for CPR have focused on chest compressions to save drowning victims. But now the American Heart Association and the American Academy of Pediatrics have updated their guidelines, saying rescue breaths are also critical.
It makes a difference.
Dr. Cameron Desfoulian explained both compressions and breathing are life-saving.
Somebody who drowned and then their heart stopped, the reason it stopped was there was no oxygen. So if you don't somehow provide them that oxygen back, it's really not all that helpful to circulate the deoxygenated blood around their body.
Michael Smith of the American Heart Association teaches CPR.
So Michael, let's say we have a drowning victim here. Under the new guidelines, what do we do?
I'm going right into compressions. Right in the center of the chest, I'm pushing down at least 2 inches at a rate of 100 to 120 per minute.
After 30 compressions, he starts rescue breaths.
Pinch the nose, tilt the head back. 1 breath, 2 breaths.
Christy Brown started the Judah Brown Project, which helps educate adults and kids about preventing drownings. She says the change is long overdue.
We in the drowning prevention community have long time believed that the rescue breaths are absolutely necessary for resuscitation after drowning.
And every parent should be CPR trained.
The World Health Organization estimates nearly 250,000 people die every year due to drowning. The Trump administration, meanwhile, says nearly $500 million in grants to study the transgender community have been canceled. A new White House memo details steps the administration has taken to comply with a January executive order banning the federal government from funding or facilitating gender-affirming care for children. The memo also says of the hundreds of research and education grants the Department of Health and Human Services has canceled, 215 were focused on the transgender community. The grants totaled $477 million.